Thank you for joining class today. This week, we're covering 2 chapters. This is the first of the 2 chapters. It is Integrating Research, Evidence-Based Practice, and Quality Improvement Processes. And I am Roberta Lavin. I am your professor for this course. For this week, we have several learning outcomes. Specifically, by the end of this lecture, I want you to state the significance of research, evidence-based practice, and quality improvement. Explain the difference between quantitative and qualitative research. Explain the difference between types of systematic reviews. And discuss how to use evidence hierarchy when critically appraising studies. So let's get started. Let's start from the beginning. A lot of times, one of the things we want to know is what exactly is research? Which should probably start with the question, what is science? Many years ago, when I was first studying nursing science as a graduate student, I came across a book by Kurlinger. And Kurlinger, I think, is one of the best books I've ever read that is very clear in explaining why we do what we do and why science and research is important. And Kurlinger said that science is the enterprise exclusively concerned with knowledge and understanding of natural phenomena. And likewise, he then says, scientists want to know and understand things. They want to be able to say, if we do such and such, then so and so will happen. Isn't that what we want to be able to do as nurses with those for whom we are providing care? If we do such and such, then so and so will happen. That is usually what we want. But it's not always what happens. Sometimes we don't have the evidence, and we don't have the evidence because there hasn't been a nurse scientist to do the research. So what is nursing research? Research is the systematic, rigorous, critical investigation that aims to answer questions about nursing phenomena. Systematic, rigorous, and critical. And we will stress that throughout the semester. What is evidence-based practice then? Evidence-based practice is the collection, evaluation, and integration of valid research evidence combined with clinical experience and an understanding of patient and family values and preferences to inform clinical decision-making. In other words, you need several things to get evidence-based practice. First of all, you have to have valid research. Then you need your own clinical experience, which you have, and which you are growing every day. And then you need to understand the patient and the family values at the same time. It is why it's so critically important that we spend quality time with our patients and that we listen to not only them, but their families. And finally, what is quality improvement? Quality improvement is systematic use of data to monitor the outcomes of care processes, as well as the use of improvement methods to design and test changes in practice for the purpose of continuously improving the quality and safety of health systems. Now, it's quality improvement that most nurses, especially most hospital nurses, are familiar with. And you're familiar with it because it is a routine part of the practices in a hospital. Almost all nurses know somebody that quality improvement is their full-time job. Often, we're kind of envious of that person because we think they have Monday through Friday 9 to 5 jobs and we're working shifts. And in reality, of course, that really isn't true. But still, it's nice to dream. There are some difference in the steps of evidence-based practice and the research process. So let me tell you the 5 steps of evidence-based practice. First, you want to ask a burning clinical question. You shouldn't ask the question that everybody's known the answer for years. If you don't move the patient, will they get bed sores? Yes, there's no need to ask that burning clinical question. Now, a more important question is always, how do we reduce them? And we have been significantly improving that process over the years. So the next step is to collect the most relevant and best evidence. We want to critically appraise the evidence, and to do that, you must first understand research and be able to read a research article and know if it is good evidence or bad evidence. Many of us would like to believe that if it's in a peer-reviewed journal or it's published in a journal, that it is then good. However, we all know that bad research sometimes makes it into good journals. It often makes it into bad journals or journals that are just out there to try and make money. But every once in a while, bad research still makes it into a good journal. And it's really important for people like you to understand and read the research and know if it is quality work or not. And then you want to evaluate the practice decision or change. Now, this is a little different from the steps in the research process, which are a little longer. In the research process, put briefly, we want to identify an area of interest or a phenomenon. We want to formulate a research question. We review the literature. And this isn't just a few articles. This is all the recent literature, usually within the last 5 to 10 years, on the topic. We select a conceptual model. We choose a research design. We obtain institutional review board approval to make sure that we're complying with legal and ethical issues. Then we collect and analyze data. We do the hard work of interpreting the results, and then we want to communicate those findings, and there are several ways to do that. The most common are through presentations and publications in the professional literature. One of the things that I want you to pay close attention to in your textbook are the 2 tables that tell you the steps of the research process and the journal format for both qualitative and quantitative research. You need to pay attention to that because when it comes time to start working on your paper, which begins almost immediately, you will need to format your paper in the form of a journal article. And I have specified in your syllabus which form I want you to use and which journal I want you to use as a guide. That said, I think it's important to distinguish for you the difference between qualitative research and quantitative research. And this is a table that I found that I think does a good job of making the distinctions clear for you. It starts with the objective purpose. We often think that qualitative research is exploratory research to establish a base of insights. Some people will say that before you do the quantitative research, you do qualitative research, and that if quantitative research on a subject already exists, there's no need to go back and do qualitative research. I think there's a lot of people that would now disagree with that. I think qualitative research adds a degree of understanding that you do not get necessarily in the quantitative research. Qualitative research helps you understand the underlying motivations and attitudes and perceptions of people. It is often a lot more useful when trying to understand patient perceptions or the perceptions of the family of those patients to do qualitative research, to take the time to understand the experience of the patient and the family. The samples are usually smaller and they're more narrow, and you're not using a statistical perspective to do them. You are usually doing enough interviews and doing enough work until clear themes develop. Often, qualitative research will take longer than quantitative research. The methodology frequently focuses on groups and in-depth interviews or ethnographies. And it can be in person, by phone, or online, which is certainly important during these times where we worry about in-person visits. Data collection is usually in the form of what we call semi-structured, using discussion guides rather than extremely specific questions, because these may change based on what the person says or does. And they can evolve over the course of the study. The data analysis is not statistical, and it's generally not numeric. It focuses on concepts and images, and it includes content analysis, observations. It's looking for themes. And then in reporting outcomes, it's directional in nature. Often it is used to develop a sound understanding as a basis of future research. Quantitative research, on the other hand, is really good if you just want the facts. You want something that is clear and is clearly understandable to you, and there are numbers that are going to tell you if it's going to be statistically significant or not. You would never use, for example, qualitative research if you wanted to create a new drug or you wanted to get a drug approved. That is going to require quantitative research. So it quantifies data so that you can generalize the results to a target audience. It measures the incidence and the motivation of attitudes or perceptions. It can be a benchmark and track data over time or predict future behaviors. If you think about quantitative research, one of the things you think about often are the psychological exams that people will take that have strict reliability and validity. You will think about quantitative research. For example, you probably all took an SAT or an ACT, and when you go to graduate school, you may take a GRE. And then they tend to be larger studies because you want to have statistical significance. Surveys can be conducted by phone or online, mobile, or email if you're doing it in the forms of the study. But it also may be tracking things that are objectively measurable, like vital signs, hospital-acquired infections, falls, for example. Data collection is highly structured questionnaires with few changes over the course of the study. It can have a wide variety of question types, but it can also be looking at other things. And other things are usually patient outcomes. For us doing nursing, we might be looking for outcomes with our patients. The data analysis is numeric and statistical. We are looking for statistical significance, and it may include advanced analytic techniques. And then, finally, almost always when we're doing reports or we're publishing or presenting our data, you're going to have graphic representation of your findings. And again, in many ways, it's the same type of how do we get our reports and our outcomes out? We do presentations and we publish. Another thing that you are going to find in your book is a hierarchy of evidence. And when you are reviewing evidence for your own research or for evidence-based practice, you need to understand the level of confidence that you should have in the research, and you need to understand the research articles. It isn't always easy, but it's a skill that every nurse needs. So if you look at this hierarchy, it's going to tell you essentially which studies are given the most credibility. And you will notice that opinions of experts are pretty low on that level. Qualitative research is low. And then you start going up. A meta-analysis is higher. And finally, when you get to the top, you get systematic reviews, which is only slightly above a randomized controlled trial. But systematic reviews or meta-analysis of randomized controlled trials look at a bunch of studies that have essentially asked the same questions over time, which is what makes them valuable. Let's talk a little bit about systematic reviews. A systematic review is a summation and assessment of a group of research studies that test a similar question. The questions need to be clear, and you need to have a detailed plan for your search. Now, there are whole books written about the Cochrane Review, which is one of the strategies that a lot of people use. And there are whole entire databases of studies that are maintained that have used this review process that you can look up for your evidence-based practice. The appraisal of a group of studies is related to that question. And it is a very long and difficult process. First of all, you need to almost always work with a research librarian that can help you find the articles that you want. When you do your review, you're probably going to find hundreds or even thousands of articles, and you're going to have to go through all of those and say which ones meet your criteria and which ones don't. And then you're going to go through some of those, and you're going to find articles that the research is not good, it's of different quality. Maybe they answered part of the questions, but not all of the questions, and those will need to be graded. A meta-analysis is a summary of a number of studies focused on one question or topic and uses a specific statistical methodology to synthesize the findings in order to draw conclusions about the area of focus. And then an integrative review is a focused review and synthesis of research or theoretical literature in a particular focus area and includes specific steps of literature integration and synthesis without statistical analysis. It can include both quantitative and qualitative articles. So remember, a meta-analysis has a statistical component. An integrative review does not have that same statistical component. One of the things I want you to now do is I want you to go to your textbook and I want you to look at all of the different kinds and in more depth of these integrative reviews, meta-analysis, and systematic reviews. And I want you to make sure that you read and learn more about them because it will be more important as the semester continues. As always, if you have questions, please email me or join me in my weekly office hours via Zoom. And I look forward to talking to you further on this topic.